Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and if you follow our YouTube channel, you know that all we do is cosmetic surgery. We talk about surgery and non-surgical things, and today we're going to talk, this is the second video I'm doing on the new filler Versa, V-E-R-S-A. This is FDA approved for wrinkles and folds, and we are going to use it today on the nasolabial folds. And in a previous video, I demonstrated that same thing with a needle. Today we're going to use the Air-Tite blunt cannula. The nice things about cannulas is, as they say, they're blunt and they're flexible. They can bend. So most people feel that there's an increased safety margin with that. Some advantages are it's a single stick. So you just have to make one little pilot hole and you can put the cannula up and inject from one puncture, and that's really nice. That cuts down on the multiple needle sticks, which really are your enemies for bruising. So join us as we inject nasolabial folds and marionette lines with the new hyaluronic acid filler Versa. So today we're going to do some of the new Versa filler, and we're going to use a blunt cannula. So it's blunt, it's not sharp, and it's flexible. And this is a great way to do this area. So we make our little pilot hole here, and we will insert our cannula. And the nice thing about using a cannula in this area is you only have to use one needle stick. And what we're doing is injecting on the way out. This is a 27 gauge cannula. You can use this in the lips. Sometimes in the folds we'll use a 25 gauge. And again, as I come out, I can re-enter in a slightly different plane. And you can see that that fold is filling up. And then one thing that we'll do, open your mouth for me please, is take this and massage it a little bit. Close for me. And if you're happy with it, you're done. And if you want to put a little bit more filler in, again, you can re-enter. And here I'm going to go just a little bit more lateral to put a little bit more filler in here. And I think that's going to inflate that nicely. So we used 0.8 of filler here, so we have a little bit more. Now we've taken the cannula off and we have put on the conventional needle. And this patient has already been numbed. And we're going to fill a little this area. Now we'll put a little Vaseline on it. Open your mouth for me, please. And do a little massage. Now I'll come back and show you the other side. So we're going to do the same thing on this side, and we'll use our 25 gauge to make our little pilot hole. Open. And the other thing you can do is to put the lip on stretch, and you can see how nicely, this is an Air-Tite cannula. They're made in by Air-Tite in Virginia Beach, and there are a number of really fine cannula companies, and this is one of them. And so you can see that as I'm withdrawing very slowly, I'm injecting the filler. So if you've ever decorated a cake or caulked a window or bathtub, put down caulking, it's the same type of thing. You have this coordinated movement of pushing in the plunger while you withdraw the syringe gently. And I can even massage this while the filler's still in. Now I can take this more superficial, as you can see. And I like to inject in multiple planes. And again, I'm going to save some of this and use it on the marionette lines here in a second. All right, so we're going to just do the final touches here. Need a little bit superficial here. And we're making a single cc, kind of go a long way. And now we'll put some Vaseline on this side. Open for me again. And massage it. So that's a nice little cannula treatment. You know, we basically use a single puncture on both nasolabial folds, and I think those will look good, and I think it'll be a natural case, and I think the cannulas are an efficient and safe way to do this. I'm Dr. Joe Niamtu, LoveThatFace.com. Joe Niamtu, cosmeticsurgeryeducation.com, and I hope you enjoy our free YouTube videos. I want to talk to you a little bit about our for-purchase video series, and if you follow our education platform, you know that in the past I had a very successful DVD cosmetic surgery video series that you would order on DVD. To become more contemporary, we've done it all over, and now it is all online. I spent 2 years and recorded over 300 hours of 1080p high-definition video, and it's fully narrated in a step-by-step teaching manner. This includes, but not limited to, topics such as blepharoplasty, brow lift, minimally invasive facelift, traditional facelift, facial implants, otoplasty, laser resurfacing, chemical peel, injectable fillers, neurotoxins, mole removal, the management of fat in the head and neck, and other topics. I think this is a great review for experienced surgeons and a great teaching tool for students, interns, residents, or anybody that wants to learn about cosmetic surgery. If you go to cosmeticsurgeryeducation.com, you can preview any video, and they're very reasonably priced. When you order a video, you can stream it 24/7, as well as download it so you own the video. I'm really excited, and I think I put together a really awesome teaching series. Check it out, cosmeticsurgeryeducation.com. I'm Dr. Joe Niamtu.